All right, so first off, I'm going to check the MAR and the patient care order form to make sure I have the right patient. I have Jaguar J. Jones and Jaguar J. Jones. I want to make sure I have the right order, which is Novolin R regular insulin at 10 units subcutaneously 30 minutes before meals. And I have Novolin R regular insulin 10 units subcutaneously 30 minutes before meals. Now I'm going to do the 5 rights of medication administration. So I have the right patient, Jaguar J. Jones, Jaguar J. Jones. The right medication, which is Novolin R regular insulin and Novolin R regular insulin. The dosage is 10 units and 10 units. The right route, which is subcutaneously and subcutaneously. And the right time, which is 30 minutes before meals and 30 minutes before meals. I also notice that he has an allergy to penicillin on both the patient care order form and the MAR. So now I will perform hand hygiene and select the correct medication. So I have Novolin R regular insulin and Novolin R regular insulin. The expiration date is 4/1/20, so it is not expired yet. The medication is going to be given 30 minutes before meals, and he has not had the medication administered yet. And it is done subcutaneously with 10 units, so I'll select the correct syringe, which is the insulin syringe. And then I will perform hand hygiene and clean off the top of the vial with an alcohol pad. So I'll pull 10 units of air into the syringe. And inject the air into the vial. And pull 10 units of insulin. I will recap the syringe. And I have 10 units of regular insulin. All right, and then I will check with another nurse for the 5 rights of medication administration. So I'll have the right patient, the right time, the right dosage, the right route, and just to make sure that the calculations are correct for the medication. Then I will make a label and it will have the patient's name, the medication that I'll be giving, and the correct dosage. And then now I will go to the patient's room. So I'll walk in, do hand hygiene, and then I will check for the 2 patient identifiers. So I have Jaguar J. Jones and Jaguar J. Jones. Date of birth is 08/25/1963, 08/25/1963, and he has a allergy ban for penicillin, and the MAR also has penicillin as an allergy. So I'll ask if he has any other allergies, and he does not. So now I will raise the bed, lower the side rails, and get the patient comfortable. And then I will check the 5 rights of medication administration. So I have Jaguar J. Jones, Novolin R regular insulin at 10 units. Will be done subcutaneously, and it is being given 30 minutes before meals. So then I will explain the procedure to the patient. I want to give you a injection of regular insulin in the upper arm. It will just be a small prick. So I'll do hand hygiene, put on the goggles and gloves. And I will clean the area that I will be giving the injection in and check for any bruising and the integrity of the skin or muscle. So when I'm cleaning, I will start from the inside in a circular motion and work my way out. And when I'm giving a subcutaneous injection, I will pinch the skin, inject, and then apply gentle pressure to the area that I just injected. I will dispose of the syringe and the cap in the sharps container and take off my sterile gloves, or my clean gloves. And then I'll perform hand hygiene and inspect the area of injection for any reaction that the patient has. Then I will document how the patient reacted, which is the 6th right of medication administration. Then I will come back and assess the patient later if needed. So then I will move on to sites for injection. So the first site is the deltoid site, and I will locate the acromion process, which is right here, and it forms the base of the triangle. And if you go 3 fingers down, the injection site will be right under the 3 fingers in the middle of the triangle. Then the second injection site is the vastus lateralis, and is found in the anterior upper thigh, and it is a hand's width above the knee, and is also a hand's width below the greater trochanter of the thigh, so between here. And the injection site will be the 1/3 of the muscle, which is found in the middle. So the injection site would be around here. Then for the third injection site, it is the ventrogluteal, and I would have the patient lay in a supine position, and I'll take my opposite hand from the patient and locate the greater trochanter with the heel of my hand. My thumb would be pointing towards the groin, and my index finger towards the anterior superior iliac spine. Could you turn this way a little bit? So my middle finger would go along the iliac crest, which is towards the buttocks, and my index finger and middle finger would make a V, and the injection site would be in between the V.